Hey ladies, welcome back to the Mocha Women's Health Primer, where we discuss all things women's health with a mocha twist. I'm Dr. Tiffany Wittes, and this is part 2 of WAP Breastfeeding Edition, What No One Tells You About Sex Life After Baby. We start our discussion today with Nurse Ebony, a holistic fertility doula who takes a deep dive right into postpartum sex and love after baby. Let's get into it.
And being a holistic fertility doula, just holistic overall, we just try to look at like everything that's happening with the person, not just what's happening sexually, but we look at how your mind and your body, because it goes together. One thing is definitely like a stress factor, because in the 4th trimester, you're stressed out. You just got home, you just had a baby. No one's thinking about the mom. You're not a woman anymore, you're a mother. You don't feel sexy anymore. You're trying to get back to your life. You're trying to get on a routine. Your baby's up at 3 or 4 o'clock in the morning. And God knows if you're trying to breastfeed, or if you're pumping, or if you're trying to do both. And like Bryn said, you're trying to sleep and you're deciding between, okay, do I sleep for 20 minutes or do I have sex? Like, which one? I mean, unless we can have sex for like 5 minutes and I can sleep for 15.
Split the difference.
So we can like split that up, then that would probably work too. But seriously, so you're in it's such a demand on the woman at that point. But I would say for the woman to just kind of really look at what brings you joy, what is making you happy in that moment, and what can help in that moment. But like Bryn said, you really absolutely have to have open, honest, transparent communication with your husband, spouse, partner, however you refer to that, significant other, because they need to understand what is happening with you and what's going on, and that you're not making it up, and that it's real. And they also need to have their feelings understood and validated as well, so that you guys can come to a common ground or a compromise. But if they don't know what you're thinking, you don't know what they're thinking, and no one's saying anything, then you start making assumptions. When you start making assumptions, then that's a tense environment. So again, another stressor, and that's going to affect your milk supply. That's definitely going to affect your libido as well. I mean, you think you have a DOP now, like, when you start adding on the extra stressors, it's really going to be dry down there. So like, definitely you want to, worry about that. So like, I say, one thing I kind of encourage women is to think about like who you can speak with and have open, honest conversation with. Go to family and friends. And when I say family and friends, I want to say positive family and friends, people that are going to give you good information, not negativity, not someone making you feel bad because you don't feel like having sex, not someone that's going to tell you that it's wrong if you don't have sex with your husband, someone who's going to encourage you and give you some resources or some tools, or just something that's going to actually help you and not hurt you. Also self-pleasure meaning masturbation if you have to, having more sex when you can, if you can, just trying to get into different things that can maybe excite you, talking to your husband about how you feel, because some women say that they feel differently after having a baby when they're having sex. Things that they liked before, they may not like it now. Things that how they were touched prior, they may not want to be touched there anymore. So being open about that and saying, you're a little rough right now, like let's switch positions, or no, don't do that right now, or I don't feel that, let's try something different. And I think just being so open about that is really great, because in that 4th trimester, you want good things, you want to feel good. So self-pleasure is a great thing. So if they're not pleasing you, then tell them how they can please you. Tell them different ways, some things that they can change. So I think it's very important for a woman to try to find her voice, to speak for herself in that 4th trimester, because she gets lost. Everybody's worried about the baby. And we want to make sure that we're mothering the mother so that she's okay in that 4th trimester. Try some new things like with your sex life, going outside, new positions if you haven't tried them. Get a sex book. Some people want to watch porn together, or some people introduce toys, or just anything that can be helpful for you. If you need to see a therapist, I think that's very amazing to get that help, because not everyone is able to speak to their partner in that way, and they need somebody like a mediator in between that can say these things for them, because you don't want to sound defensive to your partner, and your partner doesn't want to sound defensive to you, and you guys don't want that extra tension there. It's you, it's your partner, it's a new baby. Everybody's trying to coexist together in this new phase. Everybody's born again as well. So it's just a different environment. But other things, like Misha said, the water-based lubricants, try those things. Try foods that are aphrodisiacs like oysters, try different things. Vaginal steaming that helps a lot with vaginal dryness. You want to work on that. You know, talk to your partner and let them know how you're feeling. You're dry, not necessarily because you're not attracted to them, but because, like Dr. Tiffany said, what's actually going on in your body. And then we live in this whole social media craze where there's this whole pressure for a mom to quote unquote snap back. That's not reality. That's just not reality. Like, it took you how long to create this baby, and then you're pressuring yourself to like snap back in like 3-4 weeks. Like, that's not, no, like, give yourself time to get there. But pressure of social media will make you feel like you're inadequate because you have not snapped back yet. And just guys, most of those people who have snapped back in 2 weeks, they had help that they paid for. And you can get help and pay for, and you can snap back in 2 weeks as well. Yeah, lots of it, like Dr. Tiffany said. So, you know, that pressure, just kind of be mindful of those things. And I really want people to think about what they're thinking about and how their mind is going and how they're feeling, because your mind is really that like central driving force of everything. So it starts there. If you can be positive in your mind, if you can change things in your mind, if you can speak with your partner about how you're feeling, if you guys can get a therapist possibly, or even just a great mediator that can come between, but keep that open, honest communication. And I think that will be absolutely amazing for you. And when you can become that sexual person again, each moment you can, just try it. And I really hope that there are men tuning in, or that they even watch the replay, because men feel like that. I'm sure when they saw this title, breastfeeding and sex, okay, yeah, that's for women. No, like, this is for you. You are a part of every process here. Like, you're very important. And I don't think that men realize how much their feedback is needed, because that's important as well. So I think them just bringing themselves into the conversation and saying how they feel and how we can help them as well.
One thing that a lot of people have, are kind of object to is scheduling. And I am absolutely not against that at all, because we're busy, we both work. All right, I'm gonna meet you at 8 o'clock, okay? I'm gonna put her down early, let's get it. But you know, it's almost impossible to just be spontaneous with a toddler. See a toddler who doesn't like to sleep. So that's just, sometimes you may have to schedule things and say, okay, you know, we're gonna make an appointment, you know, with each other. So, but you have to, like I said, that open, honest communication is so necessary. Someone asked about raw coconut oil as a lubricant.
Yeah, coconut oil is great. I know holistically it's great. I'll let Dr. Tiffany speak to it from her point of view. But it's great as a lubricant, and also it's great for cracked nipples when you're breastfeeding as well. So that's what I've seen people use it for. And just what Misha said about sometimes you have to schedule sex. I know it sounds like, God, why do we have to schedule sex? But don't look at it like, now I have to schedule sex. Just look at it like, oh, 8 o'clock.
It's on
now. You got an appointment. So just kind of, you can bring that spontaneity to it. You can bring that excitement to it. And even that thinking like all day, like, okay, at 8 o'clock, like this is, you know, even that will help heighten the sense of everything. It'll like, you know, make the excitement of the mood and make it better. So I think that excitement can kind of help you with the lubrication as well.
Absolutely. So do we have any?
I agree with that. We schedule and prioritize everything else.
Absolutely. Why can't you schedule that?
Were you about to do a question?
Yeah, go ahead. You were saying something.
I was just saying, we schedule and prioritize everything else. We have got to put this on the top of the list of our priorities. And sometimes it can be hard for us to reconcile what we know and how we feel. And sometimes when we're struggling emotionally with something, we just have to make a decision to do something different. And a lot of times when you just decide to do it and you do it, your emotions catch up with you. You know, you will get there eventually if you just make the decision to do it. And I wanted to go back to the question about the coconut oil. I do think it can be a good lubricant. I do think though that sometimes if you have more sensitive skin, you have to be careful with those things. So maybe topically on the nipples, it can be a good thing, but be careful when you start putting it internally, vaginally, because you don't know how you might react to it. And so you just have to be careful with that. Test it out first.
That makes sense.
Yeah. Dr. Tiffany, you made a point to say that we have to schedule those things and put it at the top of your priority list. I recently went to a Black Love panel, and it had Dondre Whitfield and Sally Richardson as a couple, and they talked about being together for like 20 plus years and things that they have to do. And one thing they talked about was sex, because yes, they're older, but like they both still love to have sex. And so definitely her husband was very open about that. And she says that what she does is she makes herself a 3-day rule. She does not go 3 days without having sex with him. He knows the 3-day rule automatic, so he knows when it's 3 days. And she says that sometimes, it doesn't wait. She doesn't wait 3 days, but she says sometimes she's like, oh, it's day 3. She was like, but she knows, like, even if she's not in the mood, she makes sure to kind of make that a point, or she tries to like work herself up the day prior because she knows like it's getting ready to be day 3. So even that is good for him, because at least he knows like every 3 days I'm in there. So I think that was great. Dr. Tiffany made a point to say like we have to put it at the top of our priority list.
Hey, listen to your elders. They clearly got it worked out. They're making it work. Yeah.
And one thing that I think a lot of us do is we forget to prioritize our relationships. We prioritize our jobs, our everything else. And when we get wrapped up in motherhood and parenthood and everything else we have going on, it's very easy to put marriage at the bottom of the priority list. And then you look around and you're like, who is this person? Mm-hmm. So you have to come back, okay, let's put our marriage first again, because at the end of the day, that marriage and that union is what brought the baby there in the first place. So you have to go back to the basics and just remember, okay, this is why we got together in the first place. We have to start dating again, things like that. It all goes hand in hand, but you have to put in the effort. It's not easy, but it's necessary.
One thing I was going to mention that I've talked with a lot of moms about is also around the issue of birth trauma. I wanted to get your guys' input on as well. So often we have these labor and deliveries that are so much different than the way we envision, right? And Dr. Tiffany, I'm sure you've seen this so often. People come in with their 3 pages of a birth plan, right? Like, I've thought it all. This is exactly how I want it to occur. And hardly ever, I imagine, does it go exactly according to plan. But for a good portion of women, there's actually birth trauma that happens that maybe, even emotionally, that we hear this so much, especially with Black moms recently, that they weren't listened to. They weren't given the correct care. Something hurt and people weren't attending to it, right? I had a nurse, I'm not going to go into that, but I had a nurse telling me for hours and hours of my labor, oh, that's just what it feels like. But there was something specific that I knew wasn't feeling right. But anyways, lucky for me, it was okay. But we hear so many of these stories where, they come out actually traumatized, right? That there is actual PTSD that happens. And so the thing that I tell moms that have gone through, emergency cesareans, or they've had this really difficult vaginal delivery, is that you've gone through a trauma. And usually if you go through any other trauma, you get in a terrible car accident, what do? We take a few days off of work, right? We schedule a therapy session, we talk with our family. In motherhood and birth, we don't have the luxury of doing that, right? We are now thrown right into motherhood. We've had no time to heal from that trauma, to process it. And we oftentimes internalize that and think, well, that must just be how it happens sometimes. Let me now go into these sleepless nights in the day-to-day. And so for a lot of women as well, they're really struggling emotionally with what just happened to me. I know I was not treated properly, or things did not go a right way. And so sometimes explaining that to their partner as well, that has taken a psychological toll, and that needs the time and space to be processed after labor and delivery, so that you can get back to that place as well. So I hear that coming up so often for some moms.
You know, I thought about something when you were talking. What is her name? The lady who married the Prince England.
Meghan Markle.
When she had a baby, like a couple days before, and they're having her come out in heels and a dress.
Oh,
and she just
Catherine.
God help me, please. And I'm like, she's probably bleeding and hurting, and she is forced to come out and just be happy when all she probably wants to do is sleep. Right? You just had a newborn like yesterday, and it's like you're just forced to just be, and you're just instantly, I'm a mother, I'm supposed to know everything to do. If I do it wrong, well, I mean, you're a horrible mother, instead of giving yourself grace. One thing I want to say about Ebony is like always my cheerleader, like, chill, give yourself some grace, like, relax, she's fine, she's alive, okay? Just relax. but it's always hard to do, because you're comparing, your kid to others, or you're comparing your motherhood to others, instead of just saying, you know what, I am the best mother I can be to my child. I'm giving her everything she needs at this moment, and that's all I can do. And just when you're giving yourself grace and allowing yourself to say, okay, you know what, I just had a baby, let me just sit in that for a minute, let me process that, and give yourself time and grace to just move into that new realm of motherhood that nobody really prepares you for until you get there. So, that's another thing. One other thing I wanted to add, trauma, you were talking about that. I had a 2nd degree tear, and it hurt. Whew, it hurt. I think almost as bad as the contractions. I think we were hand in hand. But I didn't feel it until after the epidural wore off. And then it hit me bad. But I was afraid to have sex for a while, because I'm like, they stitched me up down there. I don't want you to touch me, please. Because I don't know what it's gonna feel like.
I don't want to break.
I don't want to go to the hospital.
Right.
And I was afraid. Like, I was sitting on a donut for like 3 weeks. That donut was my best friend. So, that birth trauma, that's very real. That PTSD is very real, because you're like, I'm scared, but I know eventually I have to try, but I'm scared. So yeah, that's real.
Ebony, I know you had talked about, when we were talking about earlier, pelvic floor therapists. I know I went to one of those, and that's something that people don't talk a lot about, and that can help so much with pelvic muscles. I wonder if one of you guys might want to talk a little bit about that also.
I haven't gone to a pelvic floor therapist, but I've spoken to someone who has gone to one before, and I think I've done some research on it. I think it's amazing. But the one thing that I never thought of that this person said to me was, you don't know what it feels like as a woman to have to go to like a pelvic floor therapist, and then they have to touch on you or place their fingers inside your body, inside your vagina. And I never ever thought about anything like that until that was said to me, because we have all these thoughts of like, do this, do that, try this, try that. And I think we're all coming from a great place, but at the same time, we still don't understand like kind of the traumas that they have, or the things that they experience, or what they are going through. But from the research I've done, it can be it's so great and so beneficial. It's just like you guys says, when you're dealing with birth trauma, you're trying to get over that moment and to get to something next. But if you can get to that moment and get there, I think it's absolutely amazing from the research I've done. Have you seen anything, Dr. Tiffany?
I think pelvic floor therapists can be a great resource. And just going back to the point about birth trauma in general, it's very real. It's something that we see as an issue every day, and we have a lot of work to do. We have a lot of work to do on multiple levels. We really have to do a better job educating women about how to find a provider who fits for them, someone that they can really communicate with, someone who hears them, understands them, knows and is tuned into the unique risks that are specific to Black women, so that we can help mitigate some of the negative outcomes that we are having in this space. We also need to do a better job at advocating for ourselves and surrounding ourselves with people who can advocate for us, because we're not always in a position to do so when we're on labor and delivery. So we need to have communicated our wishes and desires, or wherever you're delivering, ahead of time. You need to have a support team with you, even if it has to be virtually right now in these COVID times. You need to have someone who knows your wishes and desires and can advocate for you, because you will not always be in your right mind in that moment to do that. You need to have someone who's not afraid to ask questions. What is that you just hung? Why did you recommend that to me? Why do you think that? Explain that a little bit more to me. All of that. And you need to have the response that you're looking for, and know that if you're not getting that response, you can ask for someone else to be on your care team. You can ask that your nurse be changed. You can ask that your physician be changed. All of those things. You have options.
I wish I would have known that first time around, right? Like, I feel like I'm a pretty well-educated professional person, but the way I was treated in my first labor and delivery, like I wasn't even there. Them asking questions to my husband about me, right? And doing things to me. And when you're a first-time mom, you don't know. You just figure, okay, they must know what they're doing, right? I don't know that I can ask those questions. The second time around, I had the doula, I had my partner tell them if I'm not able, right? So I think that's such great advice. Yeah.
Exactly. And so many of us think that those things aren't accessible to us, but there are so many programs and so many opportunities to have that support team with you to help make your experience better. I think one of the important things, though, is that we really have to be flexible in our expectations and know that we have a plan, but things don't always go as planned. And you need to be comfortable asking the questions to help you understand why there was a deviation, and that the person needs to be able to explain it to you. Okay, I wanted a vaginal delivery. Why do you think I need an unscheduled C-section? And that provider needs to be able to explain it to you in a manner that you're comfortable, so that you don't go through this grieving process, because that's exactly what it is. It is, you are grieving the loss of a dream. You had a plan. You've had that plan for years. This is what it's supposed to be. This is what it's going to be. And that's not what it is. And you really have to sit with those feelings, understand that those feelings are valid. You deserve to grieve those feelings and come to closure, so that we can not have PTSD behind the experience, and we can figure out what we need to do to make the experience better the next time.
Absolutely. I always encourage mothers, educate yourself. You have to take the time during your pregnancy, take the time to educate yourself. Take the time to do the research on your doctor. What is their C-section rate looking like? If you know you don't want a C-section, do the research on your doctor. If you have a doctor who has a 60-70% C-section rate, something is wrong. And you need to figure out, I've heard this, and you need to figure out, okay, maybe I need to find somebody else, because I don't want a C-section. And maybe they're doing them a little bit too often, and that's not what I want for myself. There are so many programs, like there's a program in LA called Frontline Doulas, and right now they're offering, I think they just offer free doula services for over 200 women right now. That's free. And now they're offering free like doula calls. You can call them, you can talk to a doula, all those type of things. There are resources out there. You just have to find them. When I was going into labor, I knew I didn't get a doula because I knew that my mother-in-law was going to be there. She's been a midwife for 30 something years. However, my daughter decided to come a week before my mother-in-law got here. So I'm like, okay, what do I do? So the only other person I knew to call was my friend Candace. And I know Candace is the pit bull. She's going to make sure we get home, period. And so I had her in there. I said, listen, I need you to make sure me and Adira get home. That's it. So she's asking, what are you drawing that blood for? What's that for? What's that? What? Like, that's what you need.
Well, we have a right to know. It's our bodies. Yeah.
Absolutely. You need somebody in there who is going to be a straight pit bull and to just basically be your bodyguard. What are you doing? Why are you doing that? Can you answer my, if you can't answer my question, go find someone who can.
Mm-hmm.
Yeah.
Exactly.
Yeah.
To Dr. Tiffany and Misha, thanks for sharing those things. I'm so grateful for Dr. Tiffany saying, yes, you can change your care team. Yes, you can ask for another nurse. You can ask for another provider, because most people feel like they cannot, especially people of color. I feel like we become like very small when we go into these institutions and these facilities, because you feel like no one's listening to you already. And then you feel like you have to get loud. And when you get loud, they label you aggressive. Then when you get labeled aggressive, you can be asked to leave. So it's such a process. And like with Misha saying, make sure that Nadira and I get home, I think that's unfortunate that as Black women, our expectation is, okay, make sure we get home. No, make sure I get home, make sure my baby's treated properly, make sure I'm treated properly, make sure I'm listened to. Those are things that we deserve as well. We don't deserve to just make it home. And I think, that's kind of where, because people are seeing all the statistics, and the statistics are real, and I know people hate seeing it because they become fearful, but it's true. And it's not to make you fearful. It's just to inform you. But I'm so thankful for Dr. Tiffany to say that, so they can hear that from an MD to say, yes, you can do these things. Also, you guys can ask for patient relations. They don't want you to ask for patient relations or to speak with someone for risk management.
Risk management.
That's always good.
That's a good one, though, because you say patient relations. Oh, they like, wait, don't call them.
They don't want you to talk to patient
risk management. Oh, you don't call them either. Well, fix the problem then.
And letting go of this whole strong Black woman, like, yes, we are strong. I get that, but it's okay to not be strong sometimes.
Exactly.
Like, and because as long as we keep that whole strong Black woman up, that's how society views us. That's how everyone else views us. That's how the next generation views us. And we keep passing it on from one generation to the next. And society is just taking that and feeling like, oh, she's strong, she's fine, she can take it. Oh, pain, she'll be okay. We're just not looked at as these vulnerable human beings.
Right. Oh, you're so strong. You're so strong. Meanwhile, she's telling you she's in pain. I've seen videos over the past year. Oh, you can take it. This is what the nurse said to the patient. Oh, you can take it. I would have fired her right then and there. I need a new nurse. Goodbye. Because you can't tell me how I'm supposed to feel inside of my body. This is my body. Because pain is subjective. You can't tell me what my pain level is. If I'm telling you I'm at a 10, don't tell me I'm at a 5, because you're going to treat me as a 5. You're going to underdose me. You're not going to give me the amount of pain medicine that I require to treat my pain. And meanwhile, I'm sitting here suffering unnecessarily.
Exactly. I had questions for my nurse, just questions about the procedure she was doing. She looked right over at my husband and asked him if I had an anxiety disorder.
Oh, wow.
Not knowing I'm a licensed clinician sitting in the bed, right? And I said, you can ask me, I'm sitting right here, right? So it's stuff like that, like, what are we doing? Why aren't we?
Wow.
So yeah, it's wild.
Wow. And the thing is, when you come into the hospital and you vocalize that you want to breastfeed, and you have certain things, okay, I want to do this. And I delivered in a baby-friendly hospital, meaning their goal is for you to breastfeed. Mm-hmm. However, I was not treated that way. I was treated, even from the moment I rolled in there, I want to breastfeed. And when I got up to the mother-baby unit, the nurse tells me, well, I have 3 couplets. Basically mean she has too many patients. Basically, because I speak nurse too. She has too many patients and she doesn't really have time to teach me how to breastfeed. That's basically what she told me without actually saying it. And I'm like, okay, all right. I guess I'll just teach myself. I mean, okay. And that night she came in, Nadira is screaming her head off. I was a brand new mom, but I knew hunger. That cry was very distinct. And she came in and she put a bottle of formula on the counter and she walked out. I'm like, okay. So I wasn't producing yet. I'm struggling. She's not latching. What do? I gave her the formula. I'm not going to let my baby suffer out of my pride. I'm not going to do that. But the next day, the nurse who came in, she was like literally like night and day. She came in, it was gentle and was patient. And that's what all your healthcare staff should be like. They should be gentle with you. Especially when you're a brand new mom, you don't know what you're doing. It doesn't matter how many books you read or how educated you are. You're still a brand new mom in this new space. And people need to treat you as though you're a human and not, oh, well, this Black mom is not going to breastfeed. Look at her as a human. And, I have pain, I feel, I'm sad, I'm happy. We have all these emotions like everybody else, but everybody doesn't always see us that way. So, and it doesn't even matter how educated you are, how much money you have. We're still treated the same across the board.
Exactly.
So
thank you for sharing that.
No problem.
And that's why it's great to have these webinars and to get information and to get educated. So that way you go in and you're armed with that information so that you can have a great experience and you can come home and you can have a WAP, even while you're breastfeeding.
Tied it up with the bow. There it is.
Yeah.
And on that note,
we'd rather have a WAP than adopt. So
if you get nothing else.
I love it. I love it.
That's it for today, ladies. As always, I appreciate you. Take good care and stay healthy, friends. Don't forget to like, share, subscribe, and turn on those notifications.